As part of efforts to achieve the World Health Organization mission of eliminating cervical cancer by 2030, QIAGEN, in partnership with Wright Biosciences Limited and the specialist laboratories, have reiterated commitment to the policy of no woman should die of cervical cancer. The Managing Director, Wright Biosciences Limited, Dr. Tunde Lawal, at an event to commemorate the World Cancer Day, said they were committed to bridging the gap in cancer diagnosis by making sure that QIAGEN solutions for cervical cancer screening were readily available.
QIAGEN, a biotechnology company based in Germany, with its policy of leaving no one behind, is committed to eradicating cervical cancer. It developed the first HPV DNA test, which remains the only test proven to reduce mortality from cervical cancer, and also a simplified, more effective option for Africa. Wright Biosciences is a premium supplier of products from leading brands and also the commercial partner of QIAGEN in Nigeria. As an advocate of no woman shall die of cervical cancer, we have been bridging the gap in cancer diagnosis by making sure that QIAGEN solutions for cervical cancer screening are readily available to laboratories. Sadly, over 90% of death from this cancer is in low and medium income countries, including our own country, Nigeria. We need to support our women who are already the most vulnerable in society through the provision of access to healthcare, social services, and education. The hope is to align and unite behind the World Health Organization mission of eliminating cervical cancer as a public health concern by the year 2030.
Experts educated participants on human papillomavirus, HPV, cervical cancer, screening, treatment, and vaccination.
We will treat cervical cancer by first history taking. How has been your sexual life? Then, are you having up to 3 times sexual intercourse in a week? Then, have you been having recurrent infection, sexually transmitted infection, or pelvic inflammatory diseases? Then you are a candidate for investigation. Investigation here is the care HPV that QIAGEN that have brought for us to now do the screening. When we screen you, we'll now pick out the cervical cancer if there is. Then we'll now treat you.
Not less than 80 women were screened with the HPV DNA test kit. The screening exercise took place at the Police College Hospital, Ikeja.
There's no need for you to be afraid of it. The earlier you know what your status is, the better for you, because you would be able to, see your gynecologist, then you get treated and you know the next step. Like they also taught us, you might have the symptoms and it's going to, show maybe in years to come. And if you don't get tested, how do you get to know if you're positive or not? So I just want to advise fellow ladies, fellow women, not to be afraid.
You can do it yourself. Just put your leg on a higher table and just swap it. After some time, you bring it out. You need no assistant to carry out this test. I think and they've really done well with the help of new technologies. Do it yourself, and it's fine for those that want their privacy to be maintained. I recommend this test for them.
My advice to every other young lady out there is you need to know your status. You need to get tested. You need to take preventive measures because now we be future mothers, so I beg. So imagine you getting these things and there is this other thing too I learned today. I learned that my female daughters, as early as they are coming of age, I should get them tested. I should teach them these things. I should give them vaccine, or I should get them vaccinated. So that's one thing. Another thing I learned today.
World Cancer Day is celebrated yearly on February 4 and the theme for the year is Close the Care Gap.